owned 2 mixed animal hospitals for about 27 years. And it was killing me. And so finally decided that I was gonna relax a little and just work out of my truck. And was always interested in acupuncture, but having 2 mixed animal hospitals, there was just absolutely no way to take the time to pursue it. So before I even sold those hospitals, I got involved with another acupuncturist on my own mare, and talk about things that drive you to go and do things or learn about things or gain more education is having to deal with it yourself. And this mare, actually, she's the one that won several world champions. She was just awesome, but at this particular time, we were just having a really hard time. Her behavior, I was doing obstacle challenges. She was bossy and aggressive and had quite a large bubble, and she'd try to bite, she'd try to kick. And I was like, you're just gonna have to find a way to chillax. And I don't sedate horses to then be able to go ride them. I think that's crazy and silly. And but I was talking to the acupuncturist that I used so that she would stand quietly to be shod. And she would go to her acupuncturist for an hour before she went to the farrier, which was also a veterinarian. And I saw that transition from the horse I had when I walked into the acupuncturist because I wasn't trained. I had to take my own horse to an acupuncturist veterinarian, and I would see the change. And I was talking about these obstacle challenges. She's really doing well. She's really winning. How can I help her not be so, aggressive and unhappy and all of that? And she was like, try these herbs. Just try them and see what you think. And that I started her on like one weekend, and the very next weekend I was at a challenge with a friend of mine I ride with all the time, and she's like, what'd you give your mare? And I didn't tell anyone. I didn't even tell my husband. And my husband was like, what do you have her on? And they're all herbs, there's no drugs, but we'll get into it with the slides. We only have 30 minutes, so we'll run through them real quickly. But she is a wood constitution, and that comes into play in acupuncture. And I didn't understand what is that? Well, it turns out so am I a wood constitution. So there was just a whole lot of this going on. And when I began to learn about how she works, and oh yeah, that's kind of how I work too, it was a lot of self-introspection. And so I end up using acupuncture just as much, if not more, for behavior than I do for lamenesses, neurological problems, dental disease, surgical procedures, chronic, the unfound lamenesses, chronic weakness in the old horse. I use it. If there's a problem, you can almost fix it with acupuncture. Not to say anything against chiropractics. I went to one for years myself, for me, not my horse. But whenever I decided to go either to acupuncture or chiropractics, I asked several people that were both and said, if you could only do one, what would you do? And they said, acupuncture from us. And why? Just not because you say that, but why? And they're like, have you gone to the chiropractor? You feel great. You leave the office, you climb back in your truck, and you're like, oh, there it is again. Muscles are tight, tendons, ligaments, whatever your anatomy, it wants to put you right back in that same place. Chiropractically, where acupuncture deals a whole lot more with balance. It's not just the here and now. It's everything. Everything is about balance. And so everyone has seen yin and yang. It's not yin and yang, it's yin and yang. That is the thing with acupuncture, traditional Chinese medicine, and veterinary medicine is all balance. You only know cold because you know hot. You only know hot, or you only know night because you know day. Everything is a rhythm. Absolutely everything is a rhythm. They see rhythm in the day. They see rhythm in nature, in the year. They see rhythm and balance in life. Like, You're born as a baby, you become an adolescent, you go and you get married and have your own children, you become a middle-aged person, your kids are off, now you got grandkiddos, and then you die. And the circle of life continues. So they see balance in absolutely everything. And that was very difficult for me as a wood constitution to relinquish control, kind of a little control freak, and see that I don't control everything. Everything has its own energy, and we all have a space here, and we all, the food we eat and things like that, everything has balance. So this, you'll see this again, especially if we have a moment to talk about, especially behavior. I think it's incredibly important. But they see spring is wood, the wood constitution. It's growth, it's the babies, it's the beginning of everything. Then you become that fiery, pistol-y adolescent, you're pissing off your parents and you're doing all kinds of rude things, and then you're sliding into earth where now you're a mother and you're learning to be gentle and kind and raising your babies, and then you're in the metal, which is the middle-aged retiree kind of age, and then you're a water, you're old, and then we die. So that cycle will go through with very largely in equine acupuncture. And this is how that cycle relates. You're born adolescent, or if you're talking about the year, wood is spring, fire is summer, earth is late summer, metal is autumn, water is winter. So it's weird to talk about acupuncture and equines, but go back to the basics, which is this. They also see rhythm, the circadian rhythm, in the time of day. So you have your own energy, the horse has its own energy that is circulating through different organs and spaces in their body based on time of day. That's why, the heart patient that coughs all night, the Cushing's dog that coughs all night, most horses will deliver between like 11 p.m. to 2 a.m. Almost always, not always, but and if women are left to their own vices, they mostly will deliver at night. So there's things that happen at times of day, because of this circadian rhythm of energy. Very, very big in acupuncture. So just to read this real quick in case you can't see it well back there, conventional Western medicine, which is what I was trained in by Texas A&M, believes in control, while traditional Chinese medicine believes in balance. A Western veterinarian, which I was for nearly 30 years, a Western veterinarian may recommend surgery or reach for antibiotics, steroids, or other pharmaceuticals. A traditional Chinese veterinary medical practitioner may recommend herbs, acupuncture, or special management practices. And that special management is what I'm talking about with special foods, because there are cold foods, warm foods, neutral foods, and all of that, versus time of day that you do things. Time of day you train a certain type of horse. Time of day you feed a certain type of horse, that kind of thing. Therapeutics of traditional Chinese veterinary medicine can avoid some of the deleterious side effects of Western drugs, but the Western drugs act much more quickly. Western drugs, everybody thinks of phenylbutazone, bute. It's just, it's in the family of non-steroidal anti-inflammatories like we take, but are there deleterious, or can there be deleterious side effects? Yes. So you don't just give it without cause or without possible repercussion. So how I was taught by Chi University in Reddick, Florida, that used to be part of University of Florida's veterinary school, but now is a standalone, it's called a tongue, pulse, and diagnostic scan. So the tongue shows you a lot of stuff. It sounds weird as humans to talk about your tongue being diagnostic, but it is. It has all of the previous, the wood, the fire, the earth, the metal, water. There's those spots on your tongue, in your eye, and on your ear. There's a lot of traditional Chinese veterinary people that just use the ear. The whole body is mapped on your ear, the whole body is mapped in your eyes, and the whole body is mapped on your tongue, and then it's mapped on your body. So we look at the horse's tongue, and here's a picture of me doing my own mare. She's 21, almost 22. She has Cushing's, has had since I diagnosed her when she was 15, and I still compete on her, and she is not controlled with drugs at all. She's only controlled with acupuncture and herbs, but hi, Phyllis. So that picture, it's kind of hard, but I read that as lavender, which she's older, she has Qi deficiency, that you don't care about that. But we look at the tongue. Is it wet? Is it dry? Is it plump? Is it small? Is it lavender, pale, red? That all means something to us. So the pulse diagnosis is next, and we use, see how that picture came out. We use our 3 fingers, and we stand, like if the horse's head towards you guys, I stand just, gently with my hand on the withers, just kind of so that I can feel if the horse is fixing to come into me, and feel the left carotid pulses in 3 different places for their quality, their speed, and then I feel the other side. And because of yin and yang and the balance in the body and the left and the right and the up and the down, everything has balance, and we can read a lot of the pulses, what they're telling us. That comes with practice, and I'm going to tell you I'm not perfect at it, but you only get better at what you practice. So then the diagnostic scan. The diagnostic scan is the most telling for me. The acupuncture meridians, which are the different meridians running all over the body, provide another diagnostic modality for equine musculoskeletal, gastrointestinal, reproductive, and organ dysfunction. It can also be useful to gauge response to treatment. So this is a busy picture. I don't know if all y'all can see that, but it just gives you some of the basic meridian points that we do with the scan. And the very first time that I used the scan in this way, a friend of mine, we were at a competition, we were at a race, and she says, well, I'm told my horse has cervical pain, neck pain, and I'm like, well, who told you that and why? And she said, well, he's not picking up his left lead. This is a flying lead change horse, only with leg, and he wasn't picking up his leads. And I said, well, yeah, I'd be happy to scan him. And I scanned him, and the only thing that triggered was his front feet. I was like, his neck isn't sore, his front feet are sore. No, his feet are fine. I have a great farrier, and my bed is wonderful, and the feet are fine. I'm like, the horse is telling me the feet are not fine. And the places, interestingly enough, for, I can't, here I was trying to touch screen the monitor. Oh, maybe it does. No, it doesn't. Okay. So the large intestine 18, and I use a needle cap, the back of a needle cap, so you can do this, and you go over that spot, and they're just like, they'll just give you one of those. Well, that's like a 2. Some of them will just move away from you, and that's like a 3. We gauge them so that when talking to each other, we actually know what we're talking about. He reacted to that spot, his small intestine 9, and his PC1. And I'm like, that horse has front feet pain. I'm telling you, I'll treat his neck, but I'm also going to treat his feet because his feet hurt. And you need to take him to your farrier and your veterinarian, have them meet when the shoes need to come off and be changed because something's wrong with the front feet. 6 months later, we're at another race. I scan the horse again. The only thing that flames is his front feet. I'm like, one day, this is going to be the downfall of this horse. You need to get with somebody now. And I did start actually that horse on herbals. So in talking about the scan and using it kind of to gauge response to treatment, it took that lady about 1.5 years, and she was a very attentive owner. It's just they never found anything. I'm like, you need to go get an MRI. Something is there. X-rays aren't finding it. Ultrasound isn't finding it. You need to get an MRI. You need to keep looking because this horse was so perfect. Otherwise, she needed to do that. And eventually, the horse got fixed. So serial evaluations of diagnostic acupoints may be particularly useful, engaging response to subtle, vague, or subclinical problems, such as those that result in a chief complaint of suboptimal performance and or lack of significant findings on Western physical exam. I don't know how many times I've had clients say, well, I just got his hock injected, and that was supposed to fix it. You know, it's like, well, actually it's not that right rear leg, it's the left forelimb. What do you mean it's the left forelimb? I'm just telling you what the horse's scan is telling me. I don't see a lameness in the left forelimb either, but you need to start looking there. This was a compensatory painful. And maybe the horse does have some changes on his hock. You know, in that comment, you know, I made in the dentistry portion, that question was, you don't look for, or you don't find what you don't look for. When the horse tells me based on the scan that there's something there, I tell people don't stop looking until you find it. So the types of acupuncture we do are these: dry needling, just sticking the needle, you know, in a very particular spot based on the diagnostics. Hemopuncture, if we get to it, I have some really cool stories about hemopuncture. It just really gets my blood pumping. Hemo means blood, and so when you puncture certain spaces, you almost anticipate blood coming out. And that, if you've ever worked for a vet or had blood drawn, or even on your own self, you know, they stick a big old needle in your big old vein and you expect that blood to just flow freely. As soon as you injure a blood vessel, your clotting cascade, if you're normal, your clotting cascade kicks in. Blood wants to clot the second that you injure the blood vessel. These hemopuncture cases, they'll just free bleed from a needle, and it's so cool because you know that it needs to happen. And sometimes it won't bleed from the needle, and I'm kind of like really disappointed. I pull the needle out and blood just comes. I'm like, oh, you know, it was necessary for the horse, and they'll just go, ah. And then all of the releases, that's, you know, term most of us hear, you know, the head drops, the ears flicker, they lick and chew, and they yawn, and you know that you just made that horse's month, you know, whenever that happened. Aquapuncture, aqua, usually we think of water, but you can use water, you can use sterile saline. I use B12. Probably the best is actually the horse's own blood, because what we're doing is we're putting that substance onto or into an acupressure point. So dry needling lasts about 2 weeks. Aquapuncture lasts about 2 to 3 weeks when I'm using vitamin B12, probably about 4 weeks if you're using the horse's own blood. And electroacupuncture lasts about a month. And that looks like this, which is really super duper fun. Most horses my older mare is a junkie. She knows that when the machine comes out, she's like, oh, this is gonna be awesome. And she just loves it, loves it, loves it. But I've got 7 leads, so I can hook up 14 different or 14 based on the diagnosis, acupuncture points, and then a low frequency, they release their own endorphins, and that's been tested and repeated scientifically because it can be reversed with Narcan. You know, opioids are reversed with Narcan, and so endorphins are our own little narcotics that we like to, our brain, our happy place. So at low frequency, they get their own endorphins, and then I do that for 10 minutes, and then I do 10 minutes at high frequency, which they just sit there and go, I just really turn into a wet noodle. And high frequency, they secrete serotonin, which is their really super duper I love life hormone that they're secreting themselves. So let's see if this, I don't have the play. Oh no, it's supposed to be a video. Let's see if this one, security warning. Enable content, okay, I see that, yeah. Do you want to make this file a trusted document? Okay, sure, why not? Okay, yay! Okay, this one. What about this one? Oh, there they go. Okay, I should tell you, well, I'll tell you later. Blood, love blood. I don't know if you could see the blood dripping down the horse onto my floor in my barn.
Bladder 23.
Okay, we don't care about all those people. So that horse, you couldn't see it. I should have been able to stop it, but I didn't fast enough. That horse had gone on a trail ride with the mister, nothing gender related, but the mister took this horse on a trail ride, and then the woman was going to take it the next week on another trail ride. And but I was going to take the horse with my horse because I was their vet for the trail ride. And this horse has this big, like, not the size of my palm, but it was about half the size of my palm, sore on its back, where unfortunately the man wasn't maybe paying close attention. Ill-fitting tack. He's a big old fella that sat back in his saddle on a whole bunch of hills. And this horse is 20-something years old and wasn't conditioned and developed this awful sore. So I've got like a period of 4 days to try to get this in tip-top shape and better fitting tack, obviously, for this thankfully littler wife to take him to a trail ride. And so there was a big sore right across the back, the spine. So doing the scan, he was sore, obviously more locally. So even though you're doing a meridian scan, and that's the bladder that was bladder 23 that was bleeding, but it doesn't have to have anything to do with the kidney and the bones. It could have everything to do with the local pain that horse was suffering. And so because that acupuncture point is for general feel good, weakness in the bones, tonifying or strengthening the health of that, I had put a needle in it and blood was just shooting out. Well, there's no large vessel there. There is nothing anatomically there that should have blood like that. Nothing. And I mean, it's just like you sticking a needle in your back. You're not going to have free-flowing blood. It just doesn't happen. And so that was super duper fun and groovy because his body needed that to come out. And I would have been the first one to go, that's just voodoo, that is crazy witchcraft, and you just got lucky and hit a big blood vessel or something, before I had been trained in acupuncture. So this is another real fun one. Before I hit play, I'll tell you about this horse. This horse, large intestine 4, it's actually that one right there. That's really good for headaches, really good for nausea, really good for sinusitis, stuff like that. And anyways, it's super duper point, one of the 4 gateway points. And so in every horse, they just love when you stick that needle in there. And this horse had a left forehoof injury and it was sore, and so I was acupuncturing him, and I had never had a large intestine 4 bleed like this sucker bled. It was so great, and that horse was just like, oh, thank you, Jesus. But I'll see if you can see the blood. I get so excited.
Yeah, baby.
Well, some of us veterinarians, I think, are kind of twisted, but maybe a little dark. But when that horse just goes, ah, and a real fun story. And then I think I have to change to my dentistry. Is that right?
Whatever you want.
Whenever I want. Okay.
Whatever you want, and the audience wants.
Okay. But it's super duper fun. I was just started. I probably was halfway through my acupuncture training, and so they had told us about hemopuncture, and I was kind of like, yeah, okay, whatever, maybe that works, maybe it doesn't, but you guys have been doing this for like 8,000 years, so I'll believe in it. I'll put some faith in it. So a friend of mine, it was one of those sensuous exams. Since she was here doing my other horse, can you look at this horse? I was like, sure. So the farrier had come out the week before had trimmed the horse, and horse always was trimmed, never a problem with that. For whatever reason, the horse was dead lame for like a week, from after this trimming. And I was like, well, I'll do my scan. I'm only partially through my training. I'll do the acupuncture and I'll just see what happens. And they're called the Jingwell points, which are the strongest in the horse, and us too, dogs, cats, everything. But they're the ones next to the ground. And because it's all about balance and the universe's energy and their own energy, and those acupuncture points are the strongest. And this horse had puffiness in those acupuncture points, and so I stuck a 25 gauge needle, which is small. It's a size or so above what you would give yourself, diabetic shots with or something, and blood just shot. And so I put the needle in the spot, and I don't know, I'm what, 1.5 feet, tops 2 feet away from the horse. Whew! It shot, and my friend, of course it's my friend, she's like, oh my God, you hurt my horse, and freaking out. I'm like, there is nothing that's supposed to do that. There is nothing there that anatomically should not happen. And I was like, that is so cool. And the horse never limped again. I called her like the next day, how's she doing? And this was Jazz, this was Gina's horse. And she's like, she's sound. She's totally sound. Had limped for a week and totally sound. And I acupunctured her in other places. But so hemopuncture, you only get better at what you practice. You don't know what you don't know. And so when I went down this journey, really because of my own mare, and I've used it on all of my horses now, it's just profound. So if you have an injury, a disease process, something you think should be getting better faster, you don't know how to help it get better, find an acupuncturist to come and help you. And just like dentistry, we all have our different opinions. We all have different things that we're better at. And so just keep, don't stop trying to learn. So that's acupuncture.